Hello and good afternoon. My name is Zulima Chavez, and I'm the Support Center Manager for the Asthma and Allergy Foundation of America, or AAFA. This episode is produced independently by AAFA and made possible in part by support from AstraZeneca. Today, we're talking about health equity and community health with Linda Nozart, also known as the Asthma Lady. She is a registered respiratory therapist and a certified asthma educator. She is currently the CEO of Noz Health Ed, LLC, a healthcare consultant business, the host of the RT's Share Tea podcast, and a public speaker on asthma education and community health program development. Welcome and thank you for joining us on today's episode, Linda.
Thank you so much for having me, Zalima. I'm very excited to be here with you guys.
Black, Hispanic, and American Indian Alaska Native people have the highest rates of asthma, deaths, and hospitalizations in the United States. This is why reducing asthma disparities is a crucial part of the work that AAFA does. You are very active in your local community. Tell us more about the asthma burden in your community and the work you do to improve asthma health.
Right. Well, as someone that has done a lot of home environmental assessments for asthma, what we're seeing in the community is the burden is, how do I say, the asthma outcomes that is associated with basically your zip code and your address. And so I can tell basically by having the address or speaking to a patient and them communicating where they're from, I already have an idea of why they may be returning back to the emergency room or being hospitalized for asthma, just based on the history of knowing the community. And the community I'm talking about is North Brooklyn, where I have done a lot of my work as an asthma educator and as a registered respiratory therapist.
How did you get involved in this work and where did your passion start?
Well, I have asthma. So I was diagnosed with asthma from the age of 8 years old. I am the only one with asthma in my family. They didn't know much about this disease. So this gave me perspective on just how families can struggle navigating through the healthcare system at a very young age. And that led me to becoming a registered respiratory therapist because I wanted to help other families, and other people with asthma, just gain control of their asthma. So this set my path towards being a registered respiratory therapist. And how I became a specialist, a certified asthma educator, is I had a patient who was a 5-year-old boy, and he went into cardiac arrest. He had a heart attack 3 times because of severe asthma. And the story is that he didn't make it. He passed away, and it was because he had a relative that really didn't notice the signs and symptoms of asthma. So it was a very sad realization for me that people are still dying from asthma, and I just this it shouldn't be so. And this was back in 2010, and even from then and everything that I have done up to now, we still have folks dying and suffering from asthma, and it should not happen. So that's why I continue to do this type of work and being in the community and spreading asthma awareness, education, and providing resources.
Yeah, thank you for sharing. I'm so sorry to hear about the story of the passing of a boy with asthma. Stories like that are so tragic and heartbreaking, and it's really sad to hear. There are many different specialists who work in the field of respiratory health, and you are a respiratory therapist. What is that, and what do they do?
Sure. Well, a respiratory therapist is a cardiopulmonary specialist. So we are a part of the healthcare team that helps with, imagine if you're having difficulty breathing, or God forbid, if you stop breathing, you would see one of us. So we are, I like to describe it, the Batman of the hospital. So we come with our gadgets. We come with oxygen. We come with ventilators. We come with breathing treatments. And we really help the patient get back to a place where they're breathing the way they should be breathing. So that is in a nutshell, what a respiratory therapist does. And we are a part of the team. You have the doctors, the nurses, the PAs, and you have respiratory therapists, all there being a part of the team.
And what is one piece of advice that you would give someone looking to start their career as a respiratory therapist?
Well, to speak to other respiratory therapists, I think that's a great place to start. They can research what a respiratory therapist is, what they do, the different career paths that we have, by going to the American Association for Respiratory Care. So that's our association. And they can shadow an RT. They can, like I said, speak to RTs. We're all over social media. I'm all over social media. So, and there's a bunch of us on social media giving like the behind the scenes of a respiratory therapist.
Those are great tips. And I'll also include a plug for our asthma management education online course for respiratory therapists and nurses. You can earn contact hours, and I'll include a link in the description box for more information. Last February, so about a year ago, AAFA launched a Facebook group to support Black women with asthma, and it's part of our Black Women with Asthma Alliance initiative. And you are an advisor for that group. Tell us more about that group and how people can join.
Yes, the Black Women's Asthma Alliance Facebook group. So this group is a group of us with asthma, where we support one another, we check in on one another, where we provide resources, we're having a good time, we share, I call it edutainment. I'll edutain some folks in regards to asthma and asthma management. And we also have our Wellness Wednesdays lives. So that's where we really try to get the members together to once again check in, share our challenges, share our successes in regards to managing our asthma and allergies, and just how we're navigating through life in general. And so it's just a good place to connect and have that the vibe of being together and connecting. So I'm really enjoying actually being a part of the Black Women's Asthma Alliance Facebook group. And you can join us, I believe, just by going on the Facebook group. Well, you have the link. You can share the
Yes.
link with them, but I share it all the time. And yeah, like we said, it's a good time.
That is awesome. I love that. It sounds like such a fun and awesome group. And we invite all Black women living with asthma and their caregivers to join through the private Facebook group that Linda mentioned. And you can join at afa.org/join BWAA.
Excellent. I hope to see you guys there.
Systemic racism and bias in the healthcare setting impedes access to healthcare and degrades the quality of care delivered to historically marginalized populations. One example of this in respiratory care is using a race correction on lung function testing. Can you explain this outdated practice and how it negatively impacts respiratory care for Black people with asthma?
Yes. Okay. So the race correction and pulmonary function test refers to adjusting pulmonary function test results according to someone's race. And what that typically did was it was lowering normal values and ranges for those who were identified as Black African American. And so what that did was it led to Blacks not being able to qualify for some necessary resources and therapies, such as oxygen therapy. So if someone really needed oxygen and their values were considered normal, they wouldn't qualify for the oxygen. Same thing for lung transplants and these type of um, necessary healthcare surgeries and processes that they need. So just making sure that patients qualify for services, necessary services that they need, therapies. And as of right now, according to the American Thoracic Society, we are advocating, we're pushing for race neutral equations in regards to pulmonary function tests, where we're no longer using things like race. Yes.
Yeah, thank you for sharing that. It's important that people are aware of different practices and how we can improve those to make sure that we are providing great healthcare access and care for everyone across the board. And another concern that has come up is there is a growing distrust of science and medical expertise. How can community health programs bridge the gap and help support people to get health care?
Yes. And you see, that was a great segue to this question because things like the race correction, so now, and I'm very for it. What's going on now is there's a lot of discussion around these issues, and what led to all of these disparities. And I'm very for it, and I actually think this is what's going to help for us to have transparency of what happened in the past, why, and moving in a direction where we are correcting. We are moving into a space where we are having the necessary dialogues, and we are on these type of platforms. We are on with you guys with Alpha, and we are on social media. We are on digital spaces, and making sure that the transparency is loud, and we're working together with the community to ask them what they need, and providing care in a way that is holistic, and we are considering everyone's needs at the current time. So meeting patients where they are today.
I love that you said that. That's so important. And me, with my background in public health, that's a big part of care is
Yeah.
meeting them where they're at, and acknowledging those factors that are impacting their health. So I love that you mentioned that because that is very important, and as often it can be overlooked.
Yes, yes. And I wear the public health hat very well too. So
Yes.
another one of my many hats.
Yes.
Yes, yes.
Your lived experience being a healthcare professional and a patient adds a lot of value to the work you do as a health educator. What is one thing you'd like the audience to know about living with asthma?
That it's not a one size fits all disease. Like, so here we are, we're talking about our own experiences and our navigating through the journey of having asthma. But I just want folks to know that it looks different for everybody. And but no matter that, whatever the version that person has, it's very serious. So people take asthma very, let me not generalize. Some people in our communities take asthma very lightly. And I hear scary things all the time. I hear things like, it's just a little asthma. And I'm like,
Mhm.
this makes my ears burn when I hear this, and trying to amplify why we have in minority communities, why we have this, we suffer or we have higher death rates in minority communities is because the the tone for asthma is that it's not that serious. And it's like, but it is. And we want to make sure that everyone, and what I say, everyone should know the basics of asthma education, because especially when it comes to children, it takes a village to raise a child. So you understand, and I really do feel like if I had met that patient, the 5-year-old boy that I mentioned, from 2010, had he met his family, met this version of me today, I do feel like I could have saved his life, because had his relatives had known the signs and symptoms of asthma, how to manage it, what to do, had an asthma action plan, just knew what they were looking at, maybe that patient would not have gone through what they went through, in that family. And so yeah, that is something that I want everyone to know. It does not matter if you have asthma or not. You should get educated in asthma education and management, because you never know if you're going to be that person to help someone and really save their life.
Yeah, and that reminds me of something I've heard in conversations where people will say, I didn't know that you could die from asthma or having asthma. And it's so important for people to be aware of not only what asthma is, but if it's uncontrolled, the impacts that it could have. And again, the story that you shared with the boy that had asthma, that is so heartbreaking. And I can only imagine how difficult that was for the families. And,
Yes.
how many more communities do we have where we hear stories of
Yes.
people having an asthma flare up and not having an inhaler or not being able to
Yes.
receive medical care quickly, and just the lasting impacts that it has. So thank you for the work that you're doing and raising awareness of this, and knowledge is power. We want to make sure that people have
Right.
information about these different conditions, and know about the resources that are available to them so they can advocate for themselves, navigate
Right.
healthcare systems. And yeah, like this helps them to make informed decisions and really empower them in their asthma care.
Correct. Correct. Totally.
And now, our final question. We have loved asking this in recent episodes. So, we've talked about various different topics, but now it's time for people who are interested in making a difference in asthma. What advice do you have for people that have a passion for community health or health education and would like to make a difference in their community?
Yes. Get outside. It's like, go in your community, be outside if possible, and connect. Connect. Even if you can't do it in person, to make sure that the person with that passion is amplifying their voice intentionally to share quality resources, that education we were talking about, and making sure folks have access to this information. And like you said, to be able to make shared decision about their health and in regards to their families. And so just be in the community. And also for me, because I don't just talk about it, I be about it. I really be outside. I really be outside. Health fairs. I'm at all different types of events. I've done asthma education at poetry slams, all types of different events, back to school events, church events. I'm at communities of faith, all types of different events, because like I said, you want to be where the people are. And also we can't forget, people are online, people are on social media. We want to also be connecting with folks through these platforms. And so yeah, that's my advice. Be outside. Just be out there and spread awareness, be intentional with this type of stuff. And it's working great for me. So
Yeah.
and who I'm speaking to. I feel like sometimes my stuff, I don't even know how people find my stuff. But it's going, and who needs it is who's getting it, which makes
Yeah.
me very happy.
Yeah, I love that you mentioned that. Just meeting our community where they're at. I've seen some awesome programs done in places like barbershops, hair salons, in waiting rooms. Just
Right.
yeah, seeing if different places are willing to let you come with brochures,
Yes.
information. And we have a
Yes.
lot of great stuff on our website, including on our online store. We have an asthma action plan and different printed
Mhm.
handouts that people can download, or you could reach out to us and we can send you a bundle. But there's a lot of great ways that people can get involved. Summer is a really popular time for health fairs and community outreach, so that's coming up in a few months. But yeah, thank you for sharing that. That's really great tip.
Oh yes, I have done it. I mean, because sometimes it doesn't even make sense. I've done it at community baby showers where it's like a baby shower and an asthma, we'll have like an asthma table there. Like I said, we've done bike rides, PTA meetings, and asthma education. We have done, yeah, PTA pancakes with, and asthma education. So it's just trying to make it engaging. So
Hmm.
however way we can do that, where we're in the community, making ourselves available and engaging the community is like the best.
Yeah, absolutely. Linda, it has been such a pleasure speaking with you today. Thank you for joining us to discuss health equity and community health.
Thank you so much, Zalima, for inviting me. I had a great time with you guys as well. And I just want to say that to anyone that really needs uh, um, a, a place, a tribe in regards to asthma and allergies, please consider joining us at the Black Women's Asthma Alliance with Alpha on Facebook. We are having a great time.
Yes, love it. And we will include that link as well in the description box below. So make sure to check it out.
Yes.
We hope you have enjoyed listening to the Afternoon Chats podcast, available on Spotify and YouTube. Don't miss our future episodes and remember to like and subscribe to our channels. The information presented in our podcast is educational and not intended to provide individual medical advice. Please speak with your healthcare provider for additional advice about your personal health. If you have questions about asthma or just need someone to talk to, our Asthma and Allergy Foundation of America online community is always open. You can find it at aaflikefranka.org/join. And as Linda mentioned, we also have support via the Black Women's with Asthma Alliance to support better asthma health for Black women during all stages of life, including childhood, adulthood, pregnancy, and menopause. And you can join this group at aaflikefranka.org/join BWAA. Before we say goodbye, we'd like to thank AstraZeneca again for their kind support of this episode. Have a good afternoon, everyone.